I'm down on the floor, so hopefully you're not going to lose my head or anything else. And I will try and continue to stare at the camera, but I am not a professional at this, so I have a tendency to want to look at the screen at the same time. So we're going to talk about the foam roller. And all of these little physio things are based on what I normally end up giving my patients when they're injured. Things that clinically work really, 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 really well. So the first things to say is everybody is different. So if you're trying something else that I have suggested, or maybe even Gemma has suggested, and it doesn't feel right for you, please back off and stop. We are offering, we'll talk about this a little bit, ways to contact us and ways to check in with us, but it's really important. Each of us as an individual, and I think we all have that problem where we look at everyone else, I do it as well, and we compare ourselves. So no comparisons, we're all individuals. So foam roller is one of the first sessions. I love this piece of kit. I know people love to hate this piece of kit, and I often say to people, well, have you got a foam roller? Have you seen a foam roller? And there's a bit of a dreaded look of horror that comes over their face. It's the bit of kit they see in the gym that's left to the side. If you've had injuries, maybe you've got into using it. I think once you've started using them, they get a little bit addictive. There's something that we really, really like. And for people who come to the run clinic, this is normally something that we pick up. And I think I forgot to mention that I'm part of a group called Physio Academy, and there are lots of us spread around. And one of the passions that we have is to do something called a run clinic, which is about prevention. So we get people who aren't injured to come in. We'll do a specific screen, have a look at some key factors, and then if you need, come in for a couple of follow-up sessions afterwards to really tailor what you can do to help your running. So foam roller, there are lots of different types that you can see. I've just picked a red foam roller. It doesn't matter about the colour. I do have people asking me that. There are different densities, there are different thicknesses. You can spend anything from £5. I've seen some ones that are £50. I do not understand what they are offering. There are some links on the event page on Facebook, because some of the bigger retailers that you would normally press click are taking a long time to deliver, but support your local shops, local stores. Those smaller independent companies still have them. So why is a foam roller so great? So there is a lot of things out there about trying to improve range of movement and improve flexibility. And that is because, say we are a bit tight in the front of our hip, called our hip flexors. One of the key parts of running is be able to get that leg back, that hip extension. So looking at some of our key muscle groups, improving your flexibility to the best of your potential, not the ballet dancer down the road, not the gymnast in Cirque du Soleil, best of your potential is only going to be something that's positive. There is quite a lot of research coming out about foam roller, and I'm going to give you the tiniest overview, but if you are really into the science and what we call the pathophysiology, like the mechanisms of how it works, you can go online and you can look it up, and they're about kind of 20-page articles. So what are the main things that are coming out about it before we go into some of those drills? So the main things is, before we train, there is some evidence to say that static stretches, so stretches that you are holding for prolonged periods of times, may affect your strength gain. So a lot of coaches are veering away from that, but they would still like their athletes to have done some form of warming up. And there is some evidence that foam rolling gives you like a short 10-minute, about a 10-minute window that you can use. After your session, there is evidence that foam rolling coupled with some static stretching, and the static stretching session is next week, can improve your flexibility on a long-term basis if you commit to it. So short-term there is benefits, and we'll talk about those, but long-term it can help with your flexibility. The frequency, how much should you do? In all those articles, every single person comes up with their own technique, which isn't really great as a standard, but we're thinking 3 times a week, possibly after you do your run, or if you are doing those important strength and conditioning sessions, then I would do this as well. That's what I do. I love foam rollers so much that I have one in my bag which comes skiing with me. It's a much lighter version, and I'll use it after skiing just to try and help not have so many DOMs. And that is one of the things, the effects that the foam roller can have. It has been shown to help delayed onset muscle soreness. It has been shown to kind of help reduce some of the pain threshold, so the pain sensitivity. We've talked about that flexibility, and that's one of the important things. The reasons, there are so many. The way that the foam roller works is it's called myofascial release. So our body is formed of fascia. So I think about like really big connective tissues, not quite like a spider's web, but like a really thick Marvel Comics Spider-Man, go with me on this kind of visual thing. You know when he goes split and you see that first bit that looks quite sticky, and then you've got all those tendrils that come out. Think about fascia like that, and it weaves all the way through your body. It's the thing that connects like your little toe to the top of your head, and that's absolutely genuine. And fascia is something like 2/3 water. It's a really important thing, and I think people are going to find out more and more and more about it. And so when we're doing the foam roller, we're affecting the fascia, and we're affecting lots of properties within the fascia. We're affecting the fluid content. There's even something called the piezoelectric field, which is about the chemical frequency, and we're seeming to have a really positive effect on that as well. So lots more things that happen, but you can go away and have a read of all those articles that go into the physiology. So let's go and do some practical stuff. I am not going to demonstrate for the length of time because you'd just be staring at me doing this for ages. If you've got a foam roller, feel free to grab it now. And as I said, you just need to play with the techniques. So how long should you do it within each of those sessions that I talked about? There is this evidence to say that the slightly longer times are better, so maybe up to 60 seconds. But if that is too much, maybe start off with 20 seconds and then build up to 3 reps of that. The pressure. If you are new to using a foam roller, there are parts of your body where, well, if I filmed people as I teach them that for the first time, it looks like they think that they're doing permanent damage. You are not, but it can be sore. And if the physio tells you it can be sore, it can be sore. There is no danger with that. That should be something that's absolutely fine. However, if you've decided to foam roller over an injury, that is not a soreness that we would find acceptable. Please back away from that. We should also not foam roller over bony bits. So with your knee, you don't want to be over your knee. You don't want to be over the sides of the knee. We don't want to be directly on our Achilles tendon. We don't want to be directly over the side of our hip or at the front of our hip. We want to foam roller the squishy bits in the middle, which is what I tell all of my patients. If it feels very sore, couple of hacks to do. So really thick jeans, not your lycra jeans, really thick trousers, lots of squishy mats. That's going to put a bit of cushioning. You can go back a stage further and you can use a handheld foam roller. I don't have one here. I don't tend to use it myself, but I have suggested it to a few of my patients who have found they needed to start with that because it just was so unbearable for them. And then they did work up to a foam roller. The only other reason that that handheld roller is applicable is if you've got something going on with your potentially somewhere else in your body, because doing the foam roller is quite physical. So if you don't have the physical strength to do this, the handheld roller can be all right. So we're gonna start in a bit of an order. We'll kind of work up and down the body, and I'm only gonna really do one side just to show you. So the first is our glutes. So really, really important muscles. Hopefully you can see me kneeling. I'll sit back. So this is your glutes. You've also got a muscle called piriformis in here. Right at the side, so this is the side of my hip. The bit just behind my hip bone is my hip abductors. We'll talk about those in our strength session. Hugely important. Very, very simple to foam roller these. You sit on it. Very easy, and you can sit. And you can see at the moment I've crossed my leg, and you can see that I'm moving my body. Maybe I want to twist to the side. Maybe I actually want to have a leg straight and roll. Depending on the size of your foam roller, you can do one at a time, or you can sit on it and do both bottom cheeks at the same time. Just be careful with that because you don't really want to be massaging that tailbone, that coccyx. That can get quite sore and quite tender. So sometimes actually having it a little bit on the diagonal, massaging into that, maybe 20 seconds, 30 seconds. In terms of the pressure, if 0 is you're not really doing anything, maybe you've lifted yourself up with your arms, and 10 out of 10 is you're putting every single bit of effort into that, maybe 5 to 7, see how you feel. It's a good way to tune into your body. Maybe one side of your body is a little bit tighter. So glutes are pretty easy. You may even develop your own way of doing this. There is nothing wrong. Just don't go over that really sore bony bit of the hip. Be careful of your tailbone. Onto your hamstrings. So again, a really simple low energy way. You can sit on it. So you can do double leg. I find I don't get a huge amount of pressure when I do double leg. You'll see a lot of videos like this. I actually prefer using my arms, bending my other knee. So areas to watch for this. Please do not go directly behind, and we call this the popliteal fossa. It's quite a nice name. But the crease. Be also quite careful really bashing what we call kind of up in here, which is your ischial tuberosity, which is just where the hamstring tendon attaches all the way up here. Go nice and gently, but don't pummel any area that's too sore. If you feel, I'm like, oh God, you know what, my medial hamstring, so the hamstring on the inside of my leg, that's where I get tight. You can spend a little bit of extra time working that area. Again, something to have balance about. Don't bruise yourself. I've definitely had patients before learn to love this. They were doing really well and then they came back and they're like, I'm sore. And it just turned out that they were overdoing it. So once you've finished your foam rolling session, you know, there could be warmth, bit of tenderness, but that should fade off pretty quickly. Calf muscle. So again, you can do this with double leg, a little bit more physical, quite a good tricep workout for this, but less energy, and I'm always about less energy so you get a better quality exercise or stretch or activity. So I love using my other leg, forwards and back. Maybe my bottom's lifted up a little bit still. I can do it with my bottom down. This is great. You can kind of really turn the foot in and out, really work through those different parts of your calf. Please not onto this fleshy, this little bit at the back, which is called your Achilles tendon. All the squishy bits. So turning over, we'll do the quads, and then we'll start getting into the more complicated positions, which is your adductors, which is your groin, and then everybody's favorite, your ITB. So everyone's going, oh, the ITB. Amazing, amazing, amazing thing to do. So quads, I've developed my own thing where I use my arms like a commando. Like that just sticks in my brain. So not on the hip bones itself, not kind of onto the top of the kneecaps. Pop it down, depending on the width, you can do one leg or two legs. So I'm going to lie down, put my arms in this position. I think you can see me because I can't see myself from there. So I'm just going forwards and back, forwards and back. Little things that you can do. And cross one leg over the other to have more pressure. You can bend your knee, and that just tightens up the front of your thigh, your quads. Only really appropriate if you find this quite comfortable. The other thing that I tend to do, and this does depend on the flexibility of your hips, is I turn my feet in, just get to a slightly different part, and out. Sorry, this is in, isn't it? And that's out. Really lovely. Lots of people love their quads, hamstrings and calves because it's comfortable. Adductors. So, I'll tell you what, I'm going to just spin around for this. I think that will be better. This one looks a little bit funny and it can take a while to get the right position. So, with your adductors, it's this part. So you've got to play with the angle, and I roll in and out. This works for me, rolling in and out, not forwards and back, in and out. So I'm kind of rocking side to side. I tend to find my foam roller then disappears, so I pull it up again, and then I do this. So it doesn't look very glamorous, feels really good. So in terms of sensitivity, our adductors are a muscle that a lot of people forget to stretch, and they do feel more sensitive. So adductors definitely feel more sensitive. You may find that you're only able to do 10 or 20 seconds of those, and then you have to build up. We have nerves around our leg. If you're on anything that feels tingly, please stop. It doesn't often happen, but just be aware of that. So going on to the thing that most people find the most sore, which is the ITB. So the ITB, really important, not on that bony bit of our hip, not onto the outside of the knee. Different levels to do this. I'll go straight into the traditional one, which is balancing on your forearm. I just checked myself in the TV screen so I could see. So things that the mistakes people make. So have a look at my arm. It's really nice and supported. If you're here, it's going to be really hard. You can use your other arm if you need. I call it Spidey hand because you don't want to press too much, just to give yourself that bit of support. Forwards and back, forwards and back, forwards and back. If that's too effortful, you can kind of just support yourself. You can even have your other leg down. That's not a problem. Things that I like to do with this is people do the ITB, which is on the side, but there's that bit of connective tissue that where the fascia, where your ITB meets your quads. You just tip forwards a little bit more. It's slightly more unpleasant than directly side on, but it's really useful to do. Really, really useful to do. So it's a bit addictive. So I'm standing here going, oh, it's a bit sore, but this feels quite nice. So that is your foam roller. There are lots more things that can be used. We can use it to stretch out our back. We can use it to stretch out quite a few other things. But to start off with, focus on your calves, your quads, your adductors, your glutes, your ITB. 3 times a week, or any time you do a run session or a strength session. 20 seconds if it feels too much, 60 seconds if you can work up to it. If you're going for 20 seconds, try and do 3 times. The little hacks, if it's too sore, handheld roller or thick jeans and a nice squishy mat. Don't go over the bony bits. It can really, really help you. There's loads of articles out there. It can help pre-run, just to activate everything. It can help afterwards to reduce your DOMs, make you feel a little bit better the next day. And long-term, combined with a stretching program, it's been shown to improve flexibility. So I'm going to hand you over to Gemma to add anything to that. So back to you, Gemma.